Telecommunications. As in many office settings, the telephone is the lifeline of the ambulatory care setting. By means of telecommunications, which can also include the fax, wireless technology, and email transmissions, patient appointments are scheduled, referrals are made, critical information is relayed, and the practice personality conveyed. Basic telephone techniques. First contact with office is by phone, so it should create a positive first impression. Answer incoming calls by the first ring or at least within 3 rings. Be sure to follow office guidelines when conversations must be paused to answer another call. Use hold if the call is not an emergency. Excuse yourself from the first caller. Make sure the second call is not an emergency. Then place the second call on hold and return to your first caller and thank them for holding. Never leave a person on hold unattended for more than 20 or 30 seconds. A courtesy pickup to say "I will be with you in a moment" and place them on hold again will decrease the patient's hostility and misuse of the hold button. Telephone personality. Be prepared to give the caller your complete attention. Use a pleasant, melodic voice. Use the same tone and volume as when you speak normally. Enunciation. Speak clearly and articulate. Pronunciation. Say words correctly. Your speed. You should talk at a normal rate. Your posture. If you sit up straight and use a headset, this will help to convey a better speed and modulation in your voice. Be patient. Never lose your composure. Stay calm if the call is regarding life-threatening emergencies. Use proper etiquette. Be considerate. Follow basic telephone courtesy. Hold the mouthpiece 1 to 2 inches away from your mouth. ARU, Automated Routing Unit. This is a system by which patients or callers can select a department or a person to speak with by using a telephone keypad. When using an automated system, it should be user-friendly, not complicated. Simple menu options. The first menu option should be for emergencies, usually instructing the person to hang up and dial 911 in case of emergency. Always have options to speak with a live person. Nothing frustrates a patient more, or a person calling any automated system, than not being able to press 0 or whatever number to try to speak with somebody live. How to answer incoming calls. Pick up on the first or by the 3rd ring. Smile, sit up, nothing in your mouth. Don't be chewing gum, putting a candy in your mouth, any of those things, or eating while you're talking on the phone. Use buffer words to prevent clipping off the office name. These grab the caller's attention. Good morning. Thank you for calling. Then you state the office name and your name clearly. Get the caller's information in case of disconnection. This is very important. You want to get their name and their number just in case you get disconnected. Screen the call to see who they should be speaking with. Is it urgent? The purpose is time management for the office and the callers by making sure that the caller talks to the best person to solve their issue and to assure providers' time is efficiently managed. Patients can call in and be asking to speak with the provider when it's actually a medical assistant that could be handling their situation. But then in some cases, they really do need to speak to the provider. So finding out exactly what their needs are can work with time management skills of the office. If the call needs to be transferred to someone else, explain this to the patient and tell them who you will be transferring them to. Ideally, you should put the call on hold to announce to the transfer to the person who will be getting the call, thus making sure they are available. This is not always feasible. You should always verify that the transfer was successful. Again, not always feasible. Sometimes people are busy. If they can go to voicemail, that's an option. Sometimes giving the patient or the caller that person's direct number for them to dial or for their extension. That way, if they need to call back, they can call that direct extension is always an option as well, assuming that the person that they're calling wants you to give out their extension. If a message needs to be taken because the best person to handle the call is unavailable and there is no voicemail option, then use a message pad with an NCR, which is no carbon required paper, to retain a copy of the message and be sure to gather all pertinent data. This would be who they are calling for, who is the caller, who or what is the call regarding, where and when they can be reached, the time of the call, the person taking the message. The person taking the message is important because what if the person receiving the message doesn't understand it? This way they can go back to that person and ask questions. Be sure to repeat information back to the caller to correct any errors and give the caller an approximate callback time. For example, the doctor returns calls at the end of the day, so he will call you after 4 p.m. This prevents the caller from constantly calling back. If messages are regarding a patient and the call is for the physician to return, attach the message to the patient's chart and then give it to the physician. When ending the call, you should repeat the information to the patient. So, Mrs. Jones, we will see you on Monday for your 9 a.m. appointment. Pause to allow caller to clarify information or ask further questions. Be courteous and say goodbye, but let the caller hang up first. No slang. Don't say bye or bye-bye. Calls the medical assistant can take: routine questions about the office, billing questions, scheduling new or established patients, scheduling outside tests or procedures, routine progress reports, patients call to let the doctor know they are doing better or medication is working, write information in the chart and leave it for the physician to review, requests for referrals that have already been authorized in the chart, sales reps, calls that should be referred to a provider, other physicians, poor progress reports, the patient is calling to say they are not better, the doctor's family or attorney, stat reports from testing facilities. Special consideration calls, referral calls to other facilities. Sometimes patients will call your office, but their call is best handled by another number or facility entirely. Always explain why. Provide the number. For example, your doctor ordered an MRI and it is scheduled, but the patient needs to reschedule. They should call the facility directly. That way they can schedule it during a time that is convenient for them. Ask them to return a call back to you to tell you when the appointment is so that you can put that in their chart so that you know when their appointment is and when you can expect results for that. Emergency or urgent calls. Triage calls. First, by asking questions to determine whether it's urgent or an emergency. Keeping a list of questions near the phone to evaluate the situation is helpful to keep you and the caller calm. This list should be reviewed and updated. The Good Samaritan laws do not cover a paid employee, only uncompensated situations. So if you're on your way home and you're driving by an accident, it would cover you then as long as you're working within the scope of your training. Post emergency numbers near your phone. The difference between urgent and an emergency. Emergencies need to be handled right away. Urgent means that it needs to be handled within a timely manner. Angry callers. Diffuse the situation. Do not immediately tell the patient how you can help. Listen first. Remain calm and in control. Remember, they may need to be transferred to an office manager. Elderly callers, do not make assumptions that they can either not hear you or aren't understanding you. Be aware of their hearing impairments. Speak slowly, clear. You may need to be a little louder, but do not shout. Ask the patient if they have any questions. Repeat and simplify information if needed. Communicate with a family member if needed. You want to make sure that they have a written authorization for you to communicate with a family member, however. ESL callers, English as a second language. Best thing to do is find a bilingual employee. If that is not available to you, do not make assumptions. Patients may be able to understand English better than they can speak it. Speak at a normal volume and more slowly. Be willing to review information and be patient. Telephone documentation. When information is requested over the phone, check for authorizations to release it in the chart first. Medical information requests over the phone is discouraged because verification of the caller is not 100%. Use callback verification procedures to help prevent accidental disclosure. This is when you request caller's name, phone number, and date of birth. What information is being requested and why? Call back and verify identity of the caller. Release only what was requested if permission exists in writing in the file. Document in the patient's chart what information was released, to whom, when, and why, and by whom.